talk about conjunctivitis. So a child comes in with a pink eye. What's on our differential?
Bacterial conjunctivitis, viral,
trauma.
Fantastic.
Yeah.
foreign body.
And one more. So bacterial conjunctivitis, viral conjunctivitis, trauma or foreign body,
Allergies.
and allergic conjunctivitis. Fantastic. So now let's talk about how we differentiate them. Let's say they present with just one eye that's affected. Which of those is more common in just one eye?
Trauma.
Trauma, fantastic. So if you're working up somebody and you're worried that they may have trauma, what type of history may you get from them?
Anyone noted?
Right.
Any
Injuries.
trauma.
Okay, fantastic. So if they come in saying, I got hit in the eye or I got scratched in the eye, that's pretty obvious. Sudden onset, right? So as opposed to that thing that you just kind of woke up and your eyes were crusted over, it's actually sudden onset would make you more concerned about trauma. And then, yeah, if it's just one eye. So what type of inspection are you going to do specific for trauma?
You can first visually see if you can actually see the foreign body in there, but if not, you can do the fluorescein dye.
Okay, fantastic.
Black light on there.
Beautiful. So the fluorescein dye with the UV light in order to be able to see any corneal abrasion. What else is another very important component of that exam?
Like invert or
Evert. Fantastic. So flipping the eyelids, so making sure that you're actually checking underneath the eyelids, because sometimes something like a sty or a hordeolum, that can cause, it can be underneath the lid, so you won't be able to see it very much, but it can certainly cause some irritation. So you always want to look under the lid, see if there's a foreign body stuck under there, if there's any scratches under there, ulcerations, or any other type of lesions. The pink eye that you get with a foreign body or with trauma, does it tend to be purulent?
No.
Does it tend to have much discharge?
Watery
No,
discharge.
just fluid.
Yeah, so you may have some watery discharge or you may not have very much discharge. It'll just be pretty red and irritated. Fantastic. So now let's say that we still have one eye affected, but this time it is very purulent. So woke up and it's crusted over in the morning. So eyes totally crusted shut, and it just, every time parents wipe it, they wipe away the pus, more pus develops. Now what do you think it is?
Bacterial.
Bacterial. Fantastic. Excellent. How do we treat bacterial conjunctivitis?
Eye drops to clear it up. Also cleansing the area.
What type of eye drops?
I don't remember.
So there's a few different variations of bacterial eye drops. Antibacterial, not bacterial. We don't want to introduce bacteria. But antibacterial eye drops. I personally like Ocuflox, which is actually a fluoroquinolone-based eye drop. Why do we not give fluoroquinolones to kids?
Due to tendon rupture.
Due to tendon rupture, absolutely. Why is it okay to do fluoroquinolone eye drops?
Because it's localized.
Yeah, fantastic, because it's localized, so we're not expecting them to have a big systemic response, but that's certainly going to cover a very broad spectrum of bacteria. So now let's say both eyes are affected. So what are the two things that are left on our differential of conjunctivitis?
Viral and allergic.
Viral and allergic. So what similarities do we have between viral and allergic conjunctivitis? Both eyes, and
They're chronic or longer.
oh, so it may be longer, may not. So let's say they're coming to you on day 2, so you don't know if it's chronic or not yet.
Like the injected conjunctivitis.
They're both going to be really conjuncted. They're both going to be more watery than purulent, although certainly with some viral conjunctivitis you can get some purulence. And then how do you differentiate the two?
Ask about, so for allergic, you can ask about other types of atopy, so like allergic rhinitis or asthma.
Fantastic. Or are they having any other allergic symptoms, like what?
Sneezing.
Beautiful.
Runny nose.
Fantastic. Sneezing, runny nose, maybe even a daytime or morning cough. Are they having those type of symptoms? And what about the itchiness factor? Which one is it going to be more itchy in?
Guessing the allergy.
Yeah, allergic conjunctivitis tends to be really, really itchy. And you can certainly give some antihistamine eye drops to help treat that. Bacterial conjunctivitis will be one eye and it'll be really purulent. It's also really contagious, and kids touch everything. And so they're going to touch that one eye because it's itchy and it's covered in mucus, and then they're going to touch their other eye. And so it pretty rapidly can spread to the other eye. So one of the ways that you can differentiate viral conjunctivitis from bacterial is the history. Bacterial, it started in one eye and then spread to the other, whereas viral, it's more likely to start in both eyes. And then the purulence, although like I said, with viral conjunctivitis, you can get some purulence. It's just not as much. And it can be itchy like allergies, it's just not as much. So that's difficult when a patient's saying it's itchy and you don't have anything to really compare it to with that particular patient. What other symptoms may they have if they have a viral conjunctivitis?
Probably fever.
Okay, fantastic. Yeah, so they may have like viral syndrome type symptoms. So they may have some cough, some coryza, cough, coryza, conjunctivitis.
Measles.
Fantastic, yeah, yes. And Koplik spots, beautiful. Although that's not where I was getting. It could just be any really viral prodrome that can give you that viral conjunctivitis. They may have some cough, they may have some runny nose along with it, some other systemic symptoms like fever. What do we do for viral conjunctivitis?
Just leave it alone.
Yeah, totally. So it's also contagious. You want to make sure they're washing their hands well. They're not sharing towels with anybody. You can do some cool compresses. You can even just do some kind of lubricating eye drops to help to clean out their eyes. But other than that, not a whole lot. Beautiful. Any questions?